Before we dive into the importance of arches in your feet, let's first take a moment to understand how joints function properly. I covered this in the video, What is Chiropractic? But here's a quick summary. When a bone fractures, the body initiates a natural healing process that includes inflammation, repair, and remodeling. This process occurs regardless of whether the bone is properly immobilized. However, without appropriate alignment and stabilization, typically achieved with a cast, the bone may heal in a misaligned position, leading to functional impairment or deformity. In such cases, corrective intervention, such as re-breaking and resetting the bone, may be necessary. Immobilization with a cast ensures proper positioning, allowing the remodeling phase to restore strength and structure as intended. However, when you put a cast around a broken bone, what happens to the surrounding muscles? They atrophy. Muscles, ligaments, and tendons rely on normal movement to heal and stay strong. If you were to immobilize a healthy joint with a metal cuff, it would dry out, become painful, and eventually fuse together. Joints that move in an unrestricted manner stay healthy. Joints that move in a restricted manner don't stay healthy. With that being said, your body is like a building. It needs a stable foundation to support everything above it. Just as a house with a weak foundation is at risk for structural failure, an unstable base in the body can lead to serious problems further up the chain. When a patient's arches begin to fail, there are several red flags that often become noticeable, both visually and physically. One of the first signs is foot flaring while standing or walking. In someone with proper arch support, the feet typically point straight ahead, a line at about 90 degrees to the coronal plane. But when the arches collapse, the feet tend to rotate outward, flaring away from the body's midline. This change in alignment is often subtle, but tells us a lot about the underlying structural issues. Another indicator is the shape of the Achilles tendons. In a healthy foot, the Achilles tendon should appear straight from the heel up to the calf. When the arches have failed, this tendon bows inward, which signals that the body is compensating for instability in the foot's foundation. The third red flag involves the knees and patellas, or kneecaps. When the arches collapse, it can cause the knees to rotate inward and the patellas to shift off-center. Look at this before and after example. In the initial image, you can see that the patient's knees and patellas are visibly rotated inward. After being fitted with custom orthotics, the follow-up image shows a significant improvement. The knees and patellas are aligned to the center, which reduces stress and strain on the joints and helps prevent further damage. For our next red flag, let's examine the medial arch of the foot. In a healthy foot, this arch lifts off the ground and helps distribute weight evenly. But when the medial arch collapses, as shown in our example image, you can notice that it is almost completely flat. This lack of support shifts pressure to areas of the foot that aren't built to handle it, increasing the risk of discomfort, instability, and long-term damage. Another red flag and common consequence of arch failure is the development of a hammer toe. A hammer toe is a deformity, usually affecting the second, third, or fourth toe, where the toe bends downward at the middle joint, creating a shape that resembles a hammer. Over time, this can lead to stiffness, pain, corns, calluses, and difficulty wearing shoes comfortably. But it's important to understand that the hammer toe isn't just a toe issue. It is often the result of a deeper structural problem in the feet. When the arches collapse, the way weight is distributed across the foot changes dramatically. More pressure shifts into the toes during walking, forcing them to grip the ground excessively. This overuse leads to muscle imbalances where the flexor muscles overpowers the weaker extensor and intrinsic muscles of the foot, causing the toes to curl. Additionally, as the arch drops, and the forefoot widens, the toes often contract in an attempt to create stability. When overpronation is also present, meaning the foot rolls too far inward, it places even more strain on the joints and tendon in the toes, accelerating the deformity. So in many cases, hammer toe is actually a symptom of a failing foundation in the arches. One of the final red flags of arch failure, and also one of the most practical signs of arch collapse, is uneven shoe wear. Just like a car that's out of alignment that causes its tires to wear unevenly, the same thing happens to your shoes when your arches have failed and you are out of alignment. When your arches have collapsed or your posture is off, your shoes begin to wear more heavily on one side more than the other. This not only affects your footwear, but also reflects the uneven stress being placed on your joints, which can lead to discomfort and degeneration over time. In the human body, the foundation begins with your feet. The skeletal and muscular systems rely on the feet for balance and stability. When the feet are unstable, it can lead to postural imbalances, joint dysfunction, pain, nerve dysfunction, and potential disability. A healthy foot has three critical arches: the anterior arch, the medial arch, and the lateral arch. These arches function much like the arch design of a bridge, which effectively distributes weight across its supports. An arch bridge, for example, is stronger and more durable than a simple beam bridge because it disperses stress outward, reducing strain at any single point. In a similar manner, the foot's arches distribute body weight, absorb shock, and help manage the forces of gravity while walking, standing, or running. To put it into perspective, when you walk, the heel experiences a force equal to about 2.5 times your body weight. When you run, that number increases to about 3.5 times. This force, dissipated by the arches in your feet, is similar to how shock absorbers in a car smooth out bumps in the road. In contrast, a bicycle without suspension transfers more of the impact to the rider. Likewise, feet with collapsed or weak arches send more jarring forces up through the body. When one or more of the arches collapse, the entire biomechanics of the foot changes, and that disruption doesn't stay contained. It causes a ripple effect throughout the body. A collapsed arch causes the toes to rotate outward, triggering a chain reaction. The ankle compensates by rotating inward, leading to overpronation of the foot. This inward compensatory rotation at the ankle also causes the knee, which normally bends like a hinge joint, to torque unnaturally, creating harmful shear forces. As a result, the Q angle, which is the angle between the hip, knee, and shin, increases. The Q angle is the measurement used to assess the angle of the quadriceps muscle relative to the patella and the patellar tendon. It is used to identify knee problems and can be used to monitor changes in the knee's alignment. This misalignment pulls the kneecap out of its natural tracking path, potentially leading to front of knee pain, commonly called runner's knee, irritation under the kneecap, and even stress on the ligaments like the ACL. Ironically, most people don't initially notice foot pain. They notice knee pain instead. It's common for patients to try wearing knee braces to relieve discomfort, unaware that the real problem lies below, in the feet, since the knee is simply compensating for the instability below. Bracing it doesn't address the root cause. Over time, with each daily step or moment spent standing, uneven pressure continues to strain the knees and the hips. With the average person taking anywhere from 5,000 to 10,000 steps per day, that's a lot of traumas, especially when you think of it like a car hitting a pothole, one after another, 5 to 10,000 times per day. Instead of weight being evenly distributed across the joint surfaces, certain areas become overstressed and begin to wear down prematurely. If left uncorrected, This constant torque can lead to the need for a knee replacement. In many cases, arch failure is the major, overlooked contributor to joint degeneration, osteoarthritis, and the need for knee replacements. But the compensation doesn't stop at the knee. It travels up to the hip, altering how the femur rotates within the hip socket, the acetabulum. This misalignment puts extra strain on the joint, eventually wearing down the cartilage and leading to osteoarthritis in the hip as well. The hip on the affected side drops lower than the opposite side, further exaggerating the imbalance and stress. This is known as pelvic unleveling. From there, the body continues to compensate. The pelvis tilts, and the upper body leans to the opposite side to maintain equilibrium. This occurs due to a mechanism called the righting reflex, a built-in survival response designed to keep the head and eyes level with the horizon. The brain continuously receives input from the eyes, ears, muscles, and joints to help us stay upright and visually orientated. If one part of the body shifts off balance, the rest of the body adjusts to keep the eyes level with the horizon. These constant compensations, like curving the spine or uneven shoulders, are often the body's attempt to protect its visual and balance systems. But over time, they lead to chronic tension, muscle fatigue, joint dysfunction, nerve dysfunction, pain, degenerative arthritis, and poor posture. Understanding the righting reflex helps explain why postural problems usually start from the ground up. When the feet are misaligned, the rest of the body must adapt to maintain balance. This is why fixing posture isn't just about standing up straighter. It's about correcting the imbalances to force your body to compensate in the first place. When we scan a patient's feet, we generate an image like the one shown here on the left. This represents the patient's current foot posture. On the right, we have an image that demonstrates what optimal arch structure should look like. You'll notice a variation in color across both images. Each color represents different levels of pressure between the foot and the ground. Areas shown in red indicate where the foot is making firm contact with the ground. On the right, which displays the ideal foot posture, you'll see that each toe makes contact with the ground during the standing phase, shown by the red coloring. If one or more of the toes are not red, it could indicate the presence of a hammer toe. Also, take note of the red area under the heel. The red zone is centered on the calcaneus bone, which is where the heel makes contact with the ground. At the front of the foot, you see a red area shaped like a kidney bean. This represents the anterior arch at the level of the metatarsals. Moving to the outside of the foot, you see a green zone. This indicates a well-supported lateral arch. Meanwhile, the blue area on the inside of the foot signifies a properly functioning medial arch. Now let's compare that to the image on the left, which reflects the patient's actual scan. You'll immediately notice a large red area, particularly in places where we didn't see red on the optimal scan. This is significant. On the left foot of the scan image, there's a broad red area that runs from the back of the foot to the toes, especially along the outside. This tells us that the lateral arch on the left foot has collapsed. In the forefoot area, instead of seeing a kidney bean-shaped red zone, it looks more like a sweet potato. That indicates a collapse of the anterior arch. When comparing both anterior arches in the scan image, you can see that the red shapes don't match. This is because arch failure can be bilateral, but not symmetrical, meaning one foot may be more affected than the other. That's why over-the-counter inserts, which are symmetrical from right to left, often fail to provide proper support. Effective support requires custom orthotics built to match the specific needs of each foot. Here you can see a pair of custom orthotics made for one of my patients. Their scan showed different needs in each foot, and so the orthotics were made accordingly, with different corrections for the left and right foot. As we continue evaluating the left foot's medial arch, we see that it also has begun to collapse. The red area is starting to invade the green zone. However, when we compare that to the right foot in the same scan, the medial arch appears intact. Again, most store-bought inserts only support the medial arch, and in this case, that wouldn't help because the patient's medial arch on the right foot is already fine. What needs correction are the anterior and lateral arches on both feet and the medial arch on the left. In our office, we use two diagnostic procedures to assess arch integrity: a digital foot scan and a posture evaluation. Now, you may be wondering what happens if you're diagnosed with overpronation or arch collapse. There is no shortage of orthotics and shoe inserts on the market claiming to restore proper arch function, but not all of them work, and some of them may even cause more harm than good. Let me explain why. First, most over-the-counter inserts only address the medial arch and do not support the anterior or the lateral arches at all. On top of that, they are not customized, not even from one foot to the other. There is no possible way to manufacture supports in an over-the-counter environment to meet every single patient's need. Every patient that has an arch collapse has a unique degree of arch collapse, and it can vary between their left and their right foot. In fact, after years of scanning patients, we have never found 2 feet exactly alike, not from one patient to another patient, and not even between the right and left foot of the same patient. Another issue with many orthotics on the market is that the material they are made from. Hard plastic orthotics are overly rigid and restrict motion in the foot joints. As we discussed earlier, joints need a healthy range of motion to recover and function properly. Too much restriction can lead to pain and degeneration. This is why I personally wear and recommend to my patients a soft, flexible orthotic. These orthotics are designed to support all 3 arches, allowing for healthy joint motion while at the same time limiting the damaging motion of the foot. They are custom made for each foot's specific needs. On the market today, there's a variety of shoe inserts and orthotics. One of the most popular are these gel inserts. But as you can see, this gel insert can't even support itself, let alone the arches of your feet. Let's examine a couple of other popular inserts. We have WalkFit, an insert from the Good Feet store, and a Dr. Scholl's insert. All 3 of these inserts are symmetrical and mass-produced. There is no variation from right to left. They are designed with identical arch height, regardless of what the variation of the patient's foot demonstrates. Therefore, they are incapable of addressing left-right foot imbalance. Some generic orthotics can often overcorrect an arch, causing more harm than good. WalkFit and the insert from the Good Feet store are made of hard, rigid plastic, which can limit normal motion that is needed for healthy feet. The Good Feet store also does not have a doctor on staff to evaluate your condition. Their hard plastic orthotics do not accommodate patients who have bunion deformities. Dr. Scholl's inserts, although softer than the other 2, also does not appear to me to accommodate patients who have a lateral arch deficiency. The next orthotic I have is from a patient of mine that was to a foot doctor. This is also a very rigid orthotic. It did not provide support for the anterior arch or the lateral arch. It did have a good medial arch. The background history of this patient is also quite interesting. He originally came to me for low back pain, and prior to coming to my office, he'd been to a number of chiropractors who couldn't seem to get his low back pain under control. When I examined him, I determined that his low back problem was actually a complication from the lack of arch support in his feet. So when I suggested arch support, he had told me that he had orthotics from his foot doctor and he didn't use them because they hurt his feet. You see, he's a basketball coach, and running up and down the hardwood floors was bothering him when he had the orthotics in. I then asked the patient to bring the orthotics into the office so that we could look at them. After careful examination, I determined that the orthotic from the foot doctor did not support the anterior arch or the lateral arch which the patient needed. Also, the orthotic was a very hard orthotic. My recommendation was to get a soft, flexible orthotic, one that limits damaging motion but allows normal motion. After my patient received his orthotics and used them for a couple weeks, he was amazed at how much better his feet and his low back felt using the soft, flexible orthotic. He then asked, what should I do with these, noting his hard orthotic. I suggested that I would buy them off him to show other patients the difference between a hard and a soft orthotic. At that point, he gave me the orthotics and said, you could keep them. I don't want anybody else to go through what I went through. The last orthotic I'd like to show you is the orthotic that I use and that I recommend for my patients. It is a soft, flexible orthotic that limits damaging motion but allows normal motion. It does this while supporting all three arches of the foot. These orthotics are different right to left, since most people have different feet right to left. Did you ever put the wrong size shoes on and try to walk around with them? Doesn't feel so good, does it? Well, it's the same thing when you have the wrong orthotic that is not specifically made for you. It can cause abnormal wear and tear on your joints, pain, arthritis, and disability over the long term. There is no possible way for a store to stock all the possible orthotics due to the variations in arch deficiencies that are demonstrated in the population. 3 arches per each foot, compounded by 2 feet for each individual. Arch variances not only differ from foot to foot in the same patient, but also differ from individual to individual, as well as the height variations in each of those arches. Over-the-counter inserts are typically mass-produced and symmetrical. That results in overcorrection of some arches and not enough correction in others. This results in patients experiencing complications, exacerbating their conditions and symptomatology. Each patient's personal scan is like a fingerprint. No two are alike, in that they are totally unique. That is why all our orthotics are made by hand in a lab, according to each and every patient's individual arch needs. Custom care is essential for long-term joint health and comfort. In summary, motion and balance are fundamental to overall health, and both begin with proper structure support at the feet. The foot's 3-arch configuration plays a crucial role in maintaining balance and stability. However, arch structure can vary not only from one person to another person, but even between left and right feet of the same individual. When arches collapse or become unstable, it can lead to a host of issues, including pain, arthritis, stress fractures, plantar fasciitis, heel spurs, postural deformities, and even the need for knee or hip replacements down the line. That is why a soft, flexible custom orthotic is ideal. It doesn't restrict all motion, but it helps control excessive damaging motion, promoting a return toward optimal function and long-term health. If you are experiencing any of these signs, symptoms, or conditions, we encourage you to contact our office for a comprehensive postural and foot scan. We assess the severity of your condition and create a personalized plan to help reduce pain, prevent further damage, and support your best possible outcome.